Hi, I'm Dr. Shannon Dunley, an Associate Professor of Health Services Research and Medicine and Advanced Heart Failure Cardiologist at the Mayo Clinic. Today I will be speaking about our article, Predictors and Outcomes of Renal Replacement Therapy after Left Ventricular Assist Device Implantation, which is being published in Mayo Clinic Proceedings. In this study, we examined use of dialysis and outcomes in adult patients with advanced heart failure who underwent LVAD implantation from 2007 to 2017 at the Mayo Clinic. There were several important findings. First, about 15% of patients required dialysis early after LVAD. Patients with worse preoperative renal function, higher right atrial pressure, which is usually reflective of poor RV function, and longer cardiopulmonary bypass times were at higher risk for needing dialysis. Second, patients requiring dialysis had worse outcomes. Of the patients that required dialysis early after LVAD, 1/3 had renal recovery to the point where they no longer needed dialysis, 1/3 continued to need dialysis after hospital discharge, and 1/3 died before leaving the hospital. Patients that required dialysis had much longer length of stay. In particular, it was often challenging to find a dialysis center willing to accept a patient with an LVAD, which contributed to those long hospital stays. Patients that required dialysis after LVAD, even if they had renal recovery and no longer required dialysis after discharge, were still at higher risk of death compared with those who did not require dialysis. They were also at higher risk for future GI bleeding. There are also important clinical implications of these data. Given the high incidence of dialysis after LVAD and the predictive value of baseline kidney function, all patients considering LVAD should undergo a comprehensive assessment of kidney function to include an evaluation of creatinine clearance and screening for proteinuria. In patients with advanced kidney dysfunction that does not improve with preoperative optimization, LVAD implantation may not help them to live longer and feel better. Kidney function should be discussed and considered when advising whether patients may benefit from LVAD. Furthermore, the risk of dialysis after LVAD and potential prognostic implications should be discussed with patients considering LVAD and their families to help with decision making. With regards to future research, we know that in some patients, kidney function can improve with optimization prior to LVAD. However, we still don't know the best way to optimize hemodynamics and kidney function prior to LVAD. Further work is needed in this area to be able to optimize the care and outcomes of patients considering LVAD. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.